Are there prognostic biomarkers that help determine how the cancer may behave?
Yeah, so endometrial cancer, we now know that the molecular mechanism, so what I've been talking about, these things that are happening inside the cancer cell, we now know that can drive prognosis. And so it used to be that we kind of had two big buckets of cancer. We used to say there's type 1 endometrial cancer and type 2 endometrial cancer. And now we've actually broken it down into molecular categories. So into kind of categories much more based on certainly what the cell looks like under the microscope, but also what's going on inside the cell, not only to impact treatment, but also to give a patient a better look at what their prognosis is expected to potentially be. And we actually have changed our staging system pretty recently to incorporate some of those molecular characteristics that we now know to check for.
Talking about the biomarkers, how do biomarkers impact endometrial cancer treatment options?
Yeah, so I think specifically the two that I mentioned, the mismatch repair status and the HER2 status, have really robust data that tells us that we can better kind of tailor our treatment strategy based on a patient's status. So for mismatch repair, for example, if someone is mismatch repair deficient, that tumor is going to respond very well, like incredibly well, to immunotherapy. So we now actually use immunotherapy in combination with chemotherapy to treat those cancers, especially for the cancers that have spread outside the uterus or the cancers that have, gone through initial treatment and then come back. So I think that is a really great option. Similarly, that HER2 receptor, there is a medicine that targets that receptor, which is that cell surface kind of molecule, that thing that's sitting on the cancer surface, and can treat that cancer better if that marker is expressed.